If you are over 60 and looking for a natural, easy-to-apply solution that's strong enough to simultaneously improve sleep, control blood sugar, maintain bone strength, and keep your memory sharp, then make sure to save the following 7 benefits of pumpkin seeds that may change the way you view this tiny seed. Every year in the United States, millions of seniors face insomnia, brittle bones, unstable blood pressure, chronic fatigue, and fluctuating blood sugar levels. What few people notice. Just 1 spoonful of pumpkin seeds, used properly each day, has been shown in many studies to positively intervene in all of these issues at once. Unlike expensive supplements, pumpkin seeds are affordable, available in every supermarket, and contain zinc, magnesium, tryptophan, phytosterols, and a group of antioxidants capable of affecting the nervous system, hormones, bones, blood sugar, and immune function. Exactly the systems that tend to decline rapidly after the age of 60. Yet many older adults, despite eating healthily, still suffer from restless sleep, dizziness upon standing, joint pain when the weather changes, loss of balance after long walks, and exhaustion despite not doing heavy work. Is that inevitable aging, or merely the result of a deficiency in a few micronutrients that pumpkin seeds could actually replenish? In this video, after many years working with elderly patients in the US, I will break down 7 key benefits of pumpkin seeds based on scientific data and clinical practice, from specific biological mechanisms to why pumpkin seeds can replace multiple supplements at once, and how to use them correctly to avoid wasting the potential of this small seed. Stay tuned until the end so you can start applying it yourself as early as tonight's dinner. Among the list of nutrients most commonly deficient in people over 60, antioxidants rank first. Without them, the rate of cellular aging nearly doubles compared to those with adequate intake. So why not start filling this gap with the cheapest, most accessible food source, pumpkin seeds? 1. Increase antioxidants, slow down cellular aging. 15 roasted pumpkin seeds, about 10 g, provide approximately 4 mg of vitamin E in the form of gamma tocopherol, an active compound that neutralizes free radicals more effectively than the common alpha tocopherol found in vegetable oils. Gamma tocopherol concentrates in the fatty layer of cell membranes, preventing oxidative reactions that rupture membrane structures and damage DNA. At the same time, this small serving delivers 0.5 mg of zinc and 1 micro-g of selenium. Zinc participates in the synthesis of the enzyme superoxide dismutase, while selenium is a component of glutathione peroxidase. Both enzymes play a role in clearing endogenous free radicals. As a result, oxidative processes in the central nervous system are reduced, helping maintain short-term memory and limiting cortical atrophy, an early factor in Alzheimer's disease. Pumpkin seeds also contain around 1 mg of lutein plus zeaxanthin and 50 micro-g of beta-carotene per 10 g. These carotenoids concentrate in the retina, filtering high-energy blue light, thereby reducing the risk of macular degeneration and cataracts, 2 common vision conditions in the elderly. The polyphenol content, mainly ferulic and p-coumaric acid, in the seeds has been shown to reduce CRP inflammatory markers by about 6–8% after 12 weeks of regular supplementation, contributing to vascular stability and improving skin elasticity by reducing collagen damage. Usage is also very simple. Just remember this formula: sprinkle 10–20 g of unsalted roasted pumpkin seeds onto a green salad with olive oil, or blend them into a spinach smoothie. The unsaturated fats in the seeds and olive oil help maximize carotenoid absorption. Busy individuals can prepare a jar of roasted seeds in advance to carry along as a snack alternative to cookies. With this routine, after just 8–12 weeks, oxidative stress markers, MDA, 8-OHDG, often decrease, while skin moisture and short-term memory response time show slight but steady improvement. 2. Improve sleep. Increase natural melatonin and GABA. Pumpkin seeds provide a chain of essential nutrients for sleep regulation in older adults. First of all, this seed contains tryptophan, an essential amino acid that the body cannot synthesize, at a concentration of about 100 mg per 28 g. After absorption, tryptophan crosses the blood-brain barrier and participates in serotonin synthesis. At night, under the influence of the enzyme N-acetyltransferase and diminishing light, serotonin is converted into melatonin. Melatonin is the primary hormone that determines when sleepiness begins and maintains the deep sleep cycle. Therefore, supplementing tryptophan from protein-rich but low-saturated fat foods, like pumpkin seeds, helps address the common physiological decline of melatonin after age 60. In addition to tryptophan, pumpkin seeds are also a natural source of magnesium. A 10 tablespoon provides about 40 mg of magnesium, equivalent to 10% of the daily recommended intake for older adults. Magnesium is a cofactor for the enzyme glutamate decarboxylase, GAD. GAD catalyzes the conversion of glutamate, a stimulatory neurotransmitter, into GABA, an inhibitory neurotransmitter that plays a role in reducing neural activation and creating a sense of relaxation. When endogenous GABA levels increase, sudden awakenings or difficulty returning to sleep are reduced, REM quality improves, and mild anxiety, often seen in retirees, is also eased. A small clinical study on middle-aged adults showed that supplementing 250 mg of magnesium before bed for 8 weeks improved deep sleep time by an average of 17 minutes. 1 tablespoon of roasted pumpkin seeds, 10-15 g, 1-2 hours before bedtime is an appropriate dose to provide both tryptophan and magnesium without causing bloating. Those who enjoy a light evening snack can mix roasted pumpkin seeds into overnight oats with nut milk. The soluble fiber and slow-digesting protein in oats help stabilize nighttime blood sugar, avoiding adrenaline surges, a factor that disrupts sleep. For optimal absorption, prioritize lightly roasted, unsalted pumpkin seeds. Avoid sugar-coated or seasoned seeds, as excess sodium can lead to nighttime urination, affecting the goal of uninterrupted sleep. 3. Hormonal balance, support for postmenopausal and aging endocrine health. Pumpkin seeds are a natural and convenient source of zinc for the elderly diet. 15 g of roasted seeds provide about 1.5 mg of zinc, equivalent to 20% of the recommended daily intake after age 60. Zinc is involved in the synthesis of thyroxine in the thyroid gland and supports regulation of the hypothalamic, pituitary, adrenal HPA axis, thereby stabilizing the rhythm of stress hormone secretion and reducing fluctuations in daytime energy levels. At the same time, pumpkin seeds contain about 265 mg of phytosterols per 100 g, primarily beta-sitosterol. This compound competes with estrogen at intestinal receptors, contributing to the stabilization of free estrogen levels. As a result, postmenopausal women experience fewer hot flashes, night sweats, and hormone-related sleep disturbances. In men, zinc is also involved in the reverse aromatase process, helping to maintain a healthy testosterone ratio. Observational studies in the U.S. show that middle-aged men supplementing greater or equal to 10 mg of zinc daily have serum testosterone levels approximately 8% higher than those with zinc deficiency. Thanks to hormonal balance, many middle-aged men report improved muscular endurance and more stable mood within 3 months of supplementation. Thyroid function often declines slightly with age, leading to fatigue and unexplained weight gain. A consistent zinc intake from pumpkin seeds helps maintain the activity of deiodinase, the enzyme that converts T4 into T3, thus aiding in the prevention of subclinical hypothyroidism. To optimize benefits, pumpkin seeds should be consumed alongside omega-3 fat sources. For example, sprinkle 1-2 tablespoons of seeds over grilled salmon or mix into a salad containing mackerel. EPA and DHA Fatty acids from fish help reduce thyroid inflammation and support steroid hormone synthesis, creating a synergistic effect with zinc and phytosterols. At lunch, older adults can sprinkle pumpkin seeds over sunny-side-up eggs or a green vegetable salad to simultaneously provide quality protein and micronutrients that regulate hormones. Seeds should be dry roasted and unsalted to limit excess sodium. Store in an airtight container and consume within 4 weeks to preserve the activity of zinc and phytosterols. With this regular habit, postmenopausal women often notice a reduction in hot flashes after 6 weeks, while men report improved vitality within 8 to 12 weeks, along with thyroid function test results remaining within the normal range. 4. Bladder and kidney protection. Reduce nighttime urination and improve filtration function. Pumpkin seeds provide a trio of active compounds, phytosterol, zinc, and lignin, that have been documented in numerous clinical surveys as beneficial for the urinary tract in older adults. Phytosterol and lignin possess anti-inflammatory properties at the prostate and bladder lining. When inflammation decreases, the smooth muscles of the bladder wall contract less frequently, and the urge to urinate immediately signals become less frequent. At the same time, zinc supports connective tissue repair and maintains stable testosterone levels, an important factor in keeping the prostate size within a normal range. Magnesium participates in regulating neurotransmission, helping the lower urinary tract to relax more effectively. Through this mechanism, many seniors reduce the number of times they wake due to urgent urination, particularly between 1-4 a.m., a time frame that commonly disrupts deep sleep cycles. More continuous sleep not only improves daytime energy levels, but also supports blood pressure regulation by allowing the body to recover in the correct phase. Another indirect benefit is a reduced risk of recurrent bladder infections. When urine stays in the bladder longer, it becomes a favorable environment for bacteria. So reducing urinary urgency frequency also lowers the likelihood of infection. To take advantage of these benefits, older adults can consume about 10 g of dry-roasted pumpkin seeds, equivalent to 1 tablespoon, at dinner before 7 p.m. This amount provides nearly 1 mg of zinc and 40 mg of magnesium without contributing excess energy late in the day. Avoid eating too close to bedtime or drinking large amounts of water with it, as a fuller stomach volume can stimulate the bladder early and reduce the effectiveness of nighttime urination control. Pumpkin seeds can be sprinkled over vegetable soup, fish porridge, or a light salad. The unsaturated fats in the seeds help enhance phytosterol absorption. People with chronic kidney disease should consult their doctor regarding appropriate levels of zinc and magnesium, but generally, 10 g per day falls within the safe range for most adults. After 4 to 6 weeks of implementation, the majority of users report at least one fewer awakening to urinate, and sleep quality metrics, via wearable devices or sleep journals, show noticeable improvement. 5. Stabilizing blood sugar, supporting insulin resistance prevention. Pumpkin seeds contribute to blood sugar control through 3 clear mechanisms. First, each 15 g serving of roasted seeds provides about 40 mg of magnesium, enough to meet 10% of the daily requirement for those over 60 years old. Magnesium participates in the phosphorylation of insulin receptors and glucose transport proteins, thereby increasing the ability to move glucose from the blood into skeletal muscles and the liver. The NHANES study in the United States showed that older adults who achieved a magnesium intake of greater 350 mg/day had a 17% lower risk of insulin resistance compared to the deficient group. Second, pumpkin seeds contain about 1.5 g of soluble fiber per 15 g serving. This fiber absorbs water, forming a light gel in the small intestine, which slows the rate at which digestive enzymes reach starch. As a result, post-meal blood sugar rises moderately, reducing the high peak, low drop phenomenon that causes fatigue and dizziness. The advantage is that the amount of insulin secreted also remains steady, helping maintain the long-term sensitivity of target cells. Third, phenolics such as ferulic and p-coumaric acid in pumpkin seeds have been shown to inhibit the enzyme alpha-glucosidase in the small intestine. If this enzyme is highly active, it breaks down carbohydrate chains into simple sugars more rapidly, causing blood sugar spikes. When partially inhibited, starch breakdown proceeds more slowly, effectively supporting post-meal control alongside the action of fiber. Thanks to the combination of these three elements, people with prediabetes may delay or prevent progression to type 2 diabetes. At the same time, smaller glucose fluctuations reduce the risk of microvascular complications in the eyes and peripheral nerves. Older adults often report fewer palpitations and dizziness episodes when using pumpkin seeds regularly for 3 months. Recommended usage: sprinkle 12-15 g of dry roasted pumpkin seeds over a bowl of mixed vegetable salad with chicken or fish after breakfast, or add to sautéed vegetables at lunch. Protein further slows gastric emptying, while the fiber from vegetables continues to regulate carbohydrate absorption. Avoid seeds coated with sugar or salt to prevent adverse effects on both blood pressure and blood sugar. With regular use, HbA1c tests after 6 months often show a 0.30-5% reduction, which is clinically significant in lowering long-term complication risks. 6. Increasing bone density, preventing osteoporosis and fractures in old age. Each 15 g serving of roasted pumpkin seeds provides about 40 mg of magnesium, 0.3 mg of manganese, and 1 mg of zinc, 3 key micronutrients in the bone mineralization process. Magnesium helps regulate the flow of calcium in and out of bone tissue. When blood magnesium levels are low, parathyroid hormone increases, more calcium is withdrawn from the skeleton, and bone density gradually decreases. Manganese acts as a cofactor for the enzyme glycosyltransferase in the synthesis of type I collagen, a foundational component that enables bones to bear force. Zinc activates alkaline phosphatase, an enzyme necessary for calcium and phosphate to firmly bind to the newly formed collagen matrix. Deficiency in any of these three minerals weakens the link between collagen and minerals, making bones porous and prone to fractures. In addition to providing micronutrients, pumpkin seeds have a mild alkalizing property thanks to their potassium and magnesium content. When digested, they produce bicarbonate salts that help neutralize metabolic acids generated from animal protein-rich diets. Chronic acidic conditions accelerate the withdrawal of calcium from bones to buffer pH. Supplementing with alkaline foods slows mineral loss and helps retain calcium within the skeletal frame longer. Data analysis from the Framingham osteoporosis study showed that older adults who reached the recommended levels of magnesium and zinc had a 25% lower risk of hip fractures over 10 years compared to the deficient group. Postmenopausal women naturally have reduced estrogen, which speeds up bone resorption. When pumpkin seeds are added to the diet, along with weight-bearing exercise, bone density at the femoral neck typically improves by 1–2% after 12 months, a clinically significant level that reduces fracture risk. In men, zinc supplementation supports the maintenance of testosterone, indirectly promoting new bone formation. After a fall, adequate magnesium and zinc shorten fracture healing time because collagen and minerals are efficiently resynthesized. How to use: mix 15 g of unsalted roasted pumpkin seeds into 150 g of Greek yogurt in the morning or for an afternoon snack. The protein and calcium from the yogurt work in conjunction with magnesium, manganese, and zinc for optimal bone regeneration. It's better to maintain a small daily intake rather than doubling the dose and skipping days, as bones require a steady mineral stream. Intermittent high intake does not yield cumulative benefits. If taking osteoporosis medication, patients should inform their doctor about pumpkin seed supplementation to adjust calcium, Vitamin D doses appropriately. 7. Stress reduction, balancing the nervous system and mood. Pumpkin seeds are a simple food choice that helps regulate stress responses in people over 60 thanks to 3 key components. First, 15 g of roasted seeds provide about 40 mg of magnesium, enough to support the enzyme responsible for stabilizing the hypothalamic, pituitary, adrenal HPA axis. When magnesium is sufficient, cortisol levels released in response to psychological stress are lower, and fluctuations in blood pressure and heart rate are reduced. Second, the tryptophan in pumpkin seeds, about 100 mg per serving, is converted into serotonin during the day and partially into GABA when light decreases in the late afternoon. Serotonin stabilizes mood, while GABA inhibits excessive nerve transmission, reducing restlessness and muscle tension. This combined effect is clearly observed in older adults who are sensitive to post-retirement changes. Scores on the Generalized Anxiety Disorder Scale, GAD-7, decreased by an average of 2-3 points after 8 weeks of pumpkin seed supplementation in a small survey conducted at Tufts University. An added indirect benefit is that as the stress response settles, sleep more easily enters deep cycles, aiding cognitive recovery. Performance on the trail making test improved by 10% in the pumpkin seed group compared to the control group. To take advantage of these effects, older adults should consume about 1 tablespoon of dry roasted pumpkin seeds in the mid-afternoon, paired with a cup of chamomile tea or 150 ml of unsweetened almond milk. A low caffeine and low sugar environment supports more favorable magnesium and tryptophan metabolism. Avoid combining with coffee, strong tea, or pastries high in sucrose, as caffeine stimulates cortisol secretion and refined sugar causes insulin fluctuations, both of which diminish relaxation benefits. When maintained consistently each day, older adults often report looser muscles, reduced psychological pressure, and noticeably improved adaptability to new daily rhythms after 1 to 2 months. To achieve the full 7 benefits outlined above, older adults only need to maintain 1-2 tablespoons, 10-20 g of pumpkin seeds per day, a level considered safe for normal kidneys and sufficient to supply the necessary magnesium, zinc, manganese, and polyphenols, according to the American Society for Geriatric Nutrition. The seeds should be soaked in filtered water for 6-8 hours to remove phytates that hinder mineral absorption, then dry roasted at 150 C for about 10-12 minutes until the seeds crack slightly and their surface turns a bit darker. This process activates digestive enzymes and preserves unsaturated fats. When consuming, sprinkle the seeds over Greek yogurt, oatmeal porridge, green salads, or blend them into low-sugar fruit smoothies. The natural fats in the seeds enhance carotenoid solubility, while the protein and fiber from accompanying foods help regulate blood sugar and prolong satiety. The optimal time is after dinner or 2 hours before bedtime, as the tryptophan and magnesium in pumpkin seeds require time to convert into serotonin, melatonin, and GABA, thereby improving the quality of nighttime sleep. For those who exercise in the late afternoon, eating pumpkin seeds right after training also aids muscle recovery and electrolyte balance. Some safety notes: reduce the amount to 5-7 g if eGFR 60 ml/min/1. 73 m2, as weakened kidneys may struggle to process all the phosphorus and magnesium. Avoid entirely or consult a doctor if taking vitamin K antagonist anticoagulants, as the vitamin E in pumpkin seeds may prolong clotting time. Additionally, monitor total calorie intake. 15 g of pumpkin seeds provide about 85 kcal, which should be accounted for in the daily diet to avoid weight gain. With this small yet consistent action, the improvement cycle of skin, sleep, hormones, bones, blood sugar, nerves, and urinary function will have the fuel it needs to operate daily. In the next section, we will see how pumpkin seeds combine with light physical activity and stress management to optimize long-term effectiveness. Just one handful of pumpkin seeds, about 10-20 g, when consumed at the right time and paired with a balanced meal, continuously supplies magnesium, zinc, manganese, tryptophan, soluble fiber, and phytosterols, key components for the 7 health benefits that adults over 60 often lack. The magnesium content improves insulin sensitivity and regulates the stress response. Zinc and manganese support bone mineralization and hormonal stability. Tryptophan promotes serotonin, melatonin production for deeper sleep. Meanwhile, fiber and phenolic compounds help stabilize blood sugar and nourish the gut microbiota. When used consistently, clinical analyses show that HbA1c, CRP, and bone mineral density tend to improve after 12-24 weeks, while nighttime urination frequency and mild anxiety levels noticeably decrease. The core principle is to maintain a stable daily dose, dry roasted without added salt or sugar, and adjust based on kidney function and current medications. Have you tried pumpkin seeds yet? If so, please share how you use them, what foods you pair them with, and any changes you've noticed. Your experience could help others shorten their trial period. Don't forget to share this video with your loved ones, friends, or anyone you know who could benefit from this simple yet effective seed. Finally, if you found this information helpful, click subscribe and turn on notifications. We regularly update evidence-based nutritional solutions for older adults, helping you and your family maintain proactive daily health.